Those who need medical help get another door closed in their face.
The Mental Health Services Unit at OU Medical Center is set to close. As our Colleen Chen shows us, it will test a system that's already been pushed to the edge.
Well, guys, the Psychiatry Department says OU Medical Center's Mental Health Services Unit has to close because of space, funding, and staffing issues. Mental health leaders outside of OU say the closure comes as a blow no one, especially the mentally ill, needs.
One stitch at a time, one day at a time.
It is at Jesus House where those diagnosed with mental health problems can try to find some peace.
75 or 80 is all we have space for. We could fill up another 100 beds today if we had them.
People here are often referred to or from the Mental Health Services Unit at OU Medical Center. It's the same story at Oklahoma County's Crisis Center.
It stays pretty busy, very busy as a matter of fact.
Both places rely on OU Medical Center to stabilize those who are a danger to themselves or others and need longer-term care in a locked facility.
Any loss of psychiatric beds in Oklahoma is a hardship to all Oklahomans, and in particularly OU, where they treat many individuals who do not have any private insurance.
She says it's something other hospitals are supposed to do too, but patients often get pushed to OU and crisis centers because for-profit hospitals can't afford it. Problem is, a large chunk of the mentally ill are people who do not have insurance.
It's a dangerous thing. If you put somebody that's really, really ill on the street, there's a safety issue to our police officers, to our whole community.
That's what the leader of Jesus House is worried about. State budget issues already forced a cutback in beds earlier this year. This closure will take out another 12 that she says are constantly in rotation.
They're full all the time. And, you know, if you figure that that's 12 people and maybe they stay 2 weeks, so every month that's 24 people. I think it's a really bad sign. You know, I mean, I don't know what's going to happen after that. It's kind of like that economic bubble, you know, that everybody thinks is okay, that's going to pop.
And OU's Mental Health Services Unit is set to close sometime in August. The decision is done, but the Oklahoma Department of Mental Health and Substance Abuse is planning a meeting with OU. Amy?
All right, Colleen, and part of a statement from OU Medical Center reads, the hospital and College of Medicine have an increased need for space for other programs. At the same time, the Psychiatry Department needs to focus funding and staffing on educational programs and finds it increasingly difficult to staff an inpatient unit.